Ang napapansin ko sa second trimester, madalas back pain, di sila makatulog. So, we give them advice, especially at nighttime, how they sleep. Kasi the feeling of drowning is there, the baby bump is there, so they have display ng intestines and lungs and heart. So, they are really, may mga ways and positions na i-recommend natin sa kanila. All these questions and interview, the doctor will now start to counsel. Ika-counsel na ho namin kayo. No? So, about the pregnancy, lalo kung first-timer na ang pagbubuntis ay mayroong tatlong trimester. Yung first 3 months or first trimester. The second trimester will comprise your 4, 5, and 6 months. At yung last or third trimester is your 7, 8, 9 months pregnancy. At bawat trimester po, nakaalalay po ang doktor dahil at sasabihin po kayo kung anong mga gagawin ho natin at yung mga physical exam na gagawin natin para ma-check po kayo mabuti at ng yung baby. Sa first trimester, no, that is from your first day of your menses all the way to 16 weeks. So we start from the head down to the toe. So we check first the palpebra, no, may anemia. So, they are little pale, no? We check for lesions or sa mga sores sa face nila or sa mouth. Then, we also check for the breast, no? Kasi yung mga iba, as early as first trimester, nagkakaroon ng breast tenderness or breast swelling. Ang heartbeat ng bata, naririnig sila during exam, sa tinatawag nating fetal Doppler machine, around 12 weeks, no? So, that's the time. So, if you came to the doctor at less than 12 weeks, hindi pa naririnig ni doktora yan. So, normally, the doctor will request muna for an ultrasound, no, para ma-check, no, for the viability also. And then, sa paano, no, sa legs, check natin, presence of swelling. And of course, also, sa mid-pelvis niya, check natin, ask natin si patient kung nagkakaroon siya ng mga discharge, no. During the second trimester, sa second trimester, mandatory na i-check up na natin kasi may baby bump na sila. The baby is felt moving at around 4 months, 19 weeks. We will ask the patient na feel mo na ba si baby. And then and also then by that time, si mommy nag-gain na siya ng weight. Nag-gain na siya ng 1 pound a week. So, namomonitor na rin natin yung weight gain. And then, some other symptoms na nararamdaman sa second trimester, minsan napakarami. Kasi nagkakaroon na sila ng baby bump, nagkakaroon na rin sila ng back pains, labored breathing. And sometimes for these patients, it's very disabling sa kanila. No? Yung iba, nagno-nosebleed kasi sobrang init din. Nagkakaroon sila ng mga dizziness spells. Or minsan, Doc, nadidizzy ako, nagbablanko ako. So we advise them actually around this time sa second trimester. Ang napapansin ko sa second trimester, madalas back pain, di sila makatulog. So, we give them advice, especially at nighttime, how they sleep. Kasi the feeling of drowning is there, the baby bump is there, so they have display ng intestines and lungs and heart. So, they are really, may mga ways and positions na i-recommend natin sa kanila. We get a tape measure. So, we measure the baby bump, no? From the pubis symphysis doon sa fundus, no? Kasi naka-akibat, diba? Kung 5 months ka, 27 cm, 28 cm, normally that is tantamount to weeks. So, if 27 cm, 27 weeks, 20 cm, 28 weeks, more or less ganon. At third trimester, that is from your 28 weeks all the way to 40 weeks sa due date, ang normal heartbeat po is at a range of 120 to 160 beats per minute. Chine-check ho natin lahat yan. Madalas ho, pag nagmamanas ho, medyo nakaalalay din tayo kasi minsan, it could be a sign of pending hypertension or napapakain ng sobrang alat si mommy, so na-advise talaga. Or when there is swelling, it could also signify poor circulation. So the patient is advised also to move, hindi ho laging nakahiga, no? So para ho maganda yung circulation nila.